In 2009, archaeologists excavated and analysed human skeletons from St George's Crypt in Leeds. There are at least 30 individuals represented in total, with 22 adults and 8 non-adults, some of which were able to be reassembled, and 10 of which were fully articulated. They were recovered from the crypt vaults, which were in use between 1840 and 1911, and were analysed for sex, age, stature, and pathological conditions on the bones and teeth, in order to reveal more about this historical population.
This information is important because it allows to gather clues about their past lives, such as diet, lifestyle, and work. It also gives information about any health problems they might have had, for example, diseases in joints or teeth. For this information to be the most complete possible, the preservation of the bones is very important, which can be impacted by various factors. In this case, the process of excavation initially damaged some of the skeletons. Most of the surviving bones were in fairly good condition, with little fragmentation, and 3 of the skulls had hair still attached. In order to determine the age of the individuals, multiple methods were used to increase accuracy. Using the stages of bone development and degeneration, such as the pelvis and teeth, it was determined the presence of a majority of adults, accompanied of 1 neonate, 2 young infants, a young child, 4 adolescents, and 2 young adults between 18 and 25 years old. 3 of the skeletons were classified as adults over 18 due to not being possible to determine a more precise age because of incomplete skeletons. By using sexing methods such as the pubic symphysis in the pelvis and analysis of the skull, which are helpful as they include common characteristics for each biological sex, it was possible to estimate the presence of a higher number of females than males in the burials. A number of individuals could not be sexed due to incomplete information or younger age. By calculating the height of some adult individuals by measuring their long bones, it was possible to determine that males had a higher average height for the post-medieval period, and females were comparatively shorter. A pathological analysis was conducted to provide a better understanding into the lives of the individuals at St George's Crypt, and the possible connection between themselves. A variety of conditions was observed, which include hereditary and chronic conditions. One of these conditions is called transitional vertebrae, which is a kind of malformation that happens in the spine, and was identified to 7 individuals. Although this seems to be a common condition, its prevalence in a high number of individuals from a small sample of burials indicates the possibility of being hereditary. In another adolescent individual, the sagittal suture was not present, and might have not developed. This condition can be caused either by the non-development of the suture, which can be hereditary, or by its premature fusion. One of the reasons this might happen is due to birth problems or metabolic disorders such as rickets. The premature fusion can sometimes cause deformity in the shape of the skull, and it did not happen in this instance. In addition to hereditary conditions, metabolic diseases are also present, and these are diseases that disrupt the normal function of our metabolism. One of such diseases is called cribrorbitalia and can be seen in bone as small holes in the roof of the eye orbit. It is present in 11 adults and 3 non-adults in St George's Crypt. This can be understood as an indicator of childhood stress and lack of correct nutrition. Osteoporosis seems to be another disease that affected the people of St George's Crypt. This is a condition that affects bone density, making bones weaker and easier to break. It was diagnosed in 1 mature adult female, and it is possible that other detached bones may have been affected by it, although it is harder to say for certain without using more complex exams like radiography.
In the sample of human skeletal remains analyzed by researchers, trauma seems to be a common feature. The ribs, femur, humerus, tibia, fibula, radius, and tarsals were most affected by both skeletal and soft tissue trauma. Based on the location and type of trauma, such as the Bennett's fracture of the right first metacarpal, researchers determined that these people fought, fell, twisted their ankle, and injured their shoulders. From this, we can infer that the quality of life for these individuals may have deteriorated due to their injuries. We must also remember that we can only make assumptions based on the individuals who survived long enough that their bones were affected. One seems to have suffered from maxillary sinitis stemming from a tooth abscess. Several individuals also show signs of respiratory infection. Researchers cannot assume that these individuals suffered from tuberculosis due to a lack of other skeletal identifiers. Several tibia also show signs of inflammation. However, there is no other indicative data. Thus, researchers state that this inflammation is due to a non-specific infection, possibly stemming from stress. Joint disease was also prevalent among the individuals recovered at St. George's Crypt. Joint disease affects the articular joints and is caused by a wide array of factors including activity, age, and occupation. Degenerative joint changes include the formation and reabsorption of bone and was found in the weight-bearing joints of several individuals. Osteoarthritis is caused by the deterioration of joint cartilage and was found in the hip, knee, hands, shoulder, and spine of a few individuals. This was likely caused by a weight-bearing function of these joints and advancing age. While there was a distinct lack of complete vertebral columns at the site, Schmoller's nodes were found, likely caused by frequent lifting of heavy loads. Researchers noted other unique skeletal morphologies. In 2 female skeletons, their ribs had an unusual shape, as if the chest had been compressed. This may be due to the use of corsets, which would have been a common practice at the time. Finally, one individual had an unusual pathology on the toe caused by either gout or hallux valgus.
Dental health can tell a lot about a population's diet, health, and childhood stress. The individuals excavated displayed numerous signs of dental calculus. This is the buildup of plaque on teeth. 86% of the individuals showed small amounts of calculus, while 14% exhibited medium to heavy amounts. It is possible that the high prevalence of minor calculus shows that they were practicing oral hygiene. Dental caries is the decay of teeth resulting from a high sugar diet. 30 teeth displayed caries lesions. A high caries rate can be explained by the drop in sugar prices before 1850. As a result of dental caries, approximately 1.7% of the sample displayed dental abscesses. This is a result of a buildup of bacteria in the pulp cavity of the tooth. This could be from untreated dental caries, damage to the teeth, or periodontal disease. Antemortem tooth loss is the loss of teeth prior to death. 33% of the sample displayed tooth loss. This was exhibited by an increase in frequency with age. Only one individual lost all of their teeth during life. The high rate of caries could explain the high antemortem tooth loss in the population. Dental enamel hyperplasias are the disruption of the construction of enamel during development. This shows whether an individual was malnourished, sick, or had any other stress during childhood. Hypoplasias were seen on a single individual with 4 teeth exhibiting signs of stress during development. Dental anomalies were fairly common in St. George's Crypt. This means that a large portion of the individuals buried here were likely related to each other. This is exhibited by the overcrowding, rotation, absence, or the impaction of teeth, among other anomalies.
The mortuary practice is a special funeral for burying people at a church. The burial method of human remains is mainly east to west, which is determined by the architectural pattern of the burial vaults built earlier. But a few examples of north to south burial can also be found. Individuals who were buried in the vaults were prone and have coffins. Usually, middle or upper class can offer this because they require the individual to spend money to build the vaults in the church. Low-class citizens usually can only take earth-cut grave at that time. Therefore, to bury in the vaults in York at that time also represented the embodiment of social status.
In this analysis, we have shown the demographics of this buried population and have suggested that they could have been related due to the frequency of certain congenital anomalies. Their burial in a crypt also suggests they were of high status, and as you can see, the information gathered when looking at a skeleton is incredibly valuable for the study of past populations.